Dear students, have you ever wondered why the anti-diabetic medication or the oral hypoglycemic agents like fenformin and metformin are capable of causing lactic acidosis? Because their mechanism is inhibition of gluconeogenesis so that early morning hyperglycemia can be averted. Fenformin is capable of causing lactic acidosis very efficiently and more frequently than that of metformin, so it has right now become obsolete. Metformin is very commonly being used, and metformin causes lactic acidosis in lesser frequency. Now, have you ever wondered this metformin's ability to cause lactic acidosis is the same as the defect in gluconeogenesis? When there is gluconeogenesis defect, for example, there is a defect in phosphoenol pyruvate carboxykinase enzyme, or there is a defect in fructose 1,6-bisphosphatase enzyme where gluconeogenesis does not happen, then pyruvate cannot become glucose, because of which pyruvate goes to form lactic acid. The same logic can be applicable for PDH complex defect also. PDH is pyruvate dehydrogenase complex, which tries to convert pyruvate into acetyl-CoA. If this enzyme complex is defective, then pyruvate can't become acetyl-CoA. Pyruvate becomes lactic acid. PDH complex is supported by thiamine pyrophosphate, which is vitamin B1, nicotinamide adenine dinucleotide, which is vitamin B3, and FAD, which is vitamin B2. So if there is a deficiency of these three vitamins also, you can have conversion of pyruvate to acetyl-CoA being blocked, and pyruvate can become lactic acid. In diabetic ketoacidosis, you can have ketone bodies being formed. In diabetes mellitus, lactic acid accumulation can happen. All these are metabolic reasons for lactic acidosis.